Hey guys, this video will be about the Chedoke Arm and Hand Activity Inventory. So the purpose of this assessment is to evaluate the functional abilities of the client's affected arm and hand. This is not designed to measure the client's ability to complete tasks using only their unaffected hand, but rather to encourage bilateral function. The Chedoke Arm and Hand Activity Inventory is a performance measure that focuses mainly on stroke patients, but movement and gait disorders have also been assessed. Administration of the Chedoke Arm and Hand Activity Inventory allows for making sure the client is aware of each task they're asked to perform. Each task can be demonstrated twice if needed. The client may be cued to use both hands twice, and the client may be reminded not to rest their elbows on the table twice. This assessment requires a chair without armrests, a table, and various objects that are associated with each functional task. Here is the list of functional tasks the client is asked to complete. After watching the client perform the task, there are three main steps in scoring this assessment. First, the therapist must determine which role the affected limb played in completing the task. Then, based on what role the affected limb played, the specific components that are listed are identified. Lastly, the therapist must determine based on a 7-point scale, 7 being complete independence and 1 being total assistance, what level assistance the client requires. The scores are summed to get a total at the end, with the minimum being 13 and the maximum being 91. This is what the activity scale score sheet looks like. Put the toothpaste on the toothbrush using both of your hands. Pour a full glass of water using both of your hands. Open this jar using both of your hands. Zip up the zipper using both of your hands. Call 911 using both of your hands. Wring out the washcloth using both of your hands. The test-retest reliability for the Chedoke Arm and Hand Inventory overall is excellent. The inter-rater and intra-rater reliability for both stroke and movement and gait disorders is excellent as well. The internal consistency for both stroke and movement and gait disorders is also excellent. There is excellent correlation with the Action Reach Arm Test and the Chedoke-McMaster Stroke Assessment. Possible biases for this outcome measure are that the client may not participate in all the functional activities listed, such as cleaning glasses. This may mean the client may not have knowledge of how to perform the task. To administer this assessment, the client also has to have some movement in the affected arm, so this assessment would not be beneficial for some clients post-stroke. One task requires walking upstairs, and this may not be possible for all clients. Here are my references. Thanks for watching.